Dr. Buckley. I'm here with Dr. Veras and Dr. Sergio Medina.
Good afternoon.
And the purpose of sitting down with Dr. Medina, who he works with Kriya Vita, I wanted to get some clarification on some facts about stem cells. They're not a panacea, but what they can do is that they can upregulate body's own healing potential. And so if you have say diabetes, but not type 1 diabetes where the beta cells are all destroyed from an autoimmune process, but type 2 diabetes, for example, where there are some beta cells, but they're not functioning to the degree that they should, or you have arthritis, but you still have some connective tissue within the knees. The stem cells can go into those tissues and it can work with what's there to help support that process and help to heal it.
They are non-specialized cells, and that's the key, that they have the ability to convert, to transform into a specialized type of cell. They are not specialized cells, but they have the ability to transform, to convert into a different type cell. So that's why this therapy is called regenerative therapy. And also they have the ability to reduce the inflammation, cellular destruction, to control the immune system in order to make it less aggressive, in order to diminish the damage that is being caused by a disease. And then they help with the repairing process by converting into these specific cell types.
So what they're going to do is they're going to provide some liquidity into your health bank account.
Yeah.
So your body can start spending that on regenerating and repairing within your body. Do stem cells cause cancer? What's the risk of cancer? What's stem cells?
So far with the study, with several studies that we quoted, stem cells do not cause cancer by themselves. I mean, by applying them, you don't increase your risk of getting cancer, because that's often another question that, well, can the stem cells be used to treat cancer? In this case, I say they are complementary. They work alongside with chemotherapy or radiotherapy or surgical removal of the cancer, the tumor, whatever it is. But it works alongside with those treatments in order to improve the quality of life of the patient. So they don't cure cancer, but they don't cause cancer.
What kind of patients do you generally see the most frequently with regard?
For the most part, we treat patients that already have a disease, and most of these diseases are chronic, like diabetes, arthritis, high cholesterol, high blood pressure, kidney disease, kidney failure. There are a few cases, and we wish there would be more of that. People that are healthy and they want to improve their health, but mostly we treat chronic patients. So what we've seen, especially with patients with diabetes and arthritis, is that the helps the first time they apply during the first month, they express that they feel better. They feel an increase of energy, increase of activity. They can sleep better. They don't feel as tired as they used to be. They feel an overall improvement in their quality of life, and that's because these cells, before they start converting, before they start actively transforming themselves into another cell type, they control the inflammation, they decrease the inflammation, the cellular destruction, the cellular necrosis, and overall improve the repairing system of the body. Then they will help to create or to transform themselves into healthy, working, specialized cells.